Chronic reflux disease is basically a multifactorial disease. There are many factors to contribute to this disease. There are genetic factors, there are environmental factors, and there are behavior factors, as with any other chronic disease. Common conditions like obesity also contributes to this, to the high prevalence of this disease. We reckon that probably 20% of the general population, they will experience some sort of reflux-related symptoms during their lives. And there is a range of treatments that we can provide to the patients, spanning basically from dietetic and lifestyle modifications, medications, minimally invasive endoscopic interventions, and then laparoscopic minimally invasive surgery for that. The first line of treatment for mild acid reflux symptoms is what we call dietetic and lifestyle modifications. We can educate our patients to avoid usual triggers to the symptoms, and then we can optimize medical treatment for better control over the symptoms. The majority of the patients, they will respond to this type of treatment. That there's a fair amount of patients that they do experience persistent or worsening reflux symptoms despite all the first-line treatment. And then we can consider endoscopic interventions like the Stretta procedure, or minimally invasive interventions like laparoscopic LINX procedure or laparoscopic Nissen fundoplication, or some emerging new techniques that they're coming to treat this condition. I will say a good candidate for the consideration of anti-reflux operation is a patient who has experienced reflux symptoms in the long term, that they do not respond to dietetic and lifestyle and modifications and optimization of the medical treatment, and that their symptoms, they affect their quality of life severely. The vast majority of anti-reflux procedures nowadays, they've been performed with minimally invasive methods, which is basically can be endoscopic or laparoscopic. In terms of endoscopic procedures, we have the Stretta procedure. And in terms of laparoscopic procedures, we have the traditional laparoscopic Nissen fundoplication, but also new techniques, that the laparoscopic LINX device and the stop reflux method. Acid reflux surgery is very successful, provided that we select the appropriate patients, candidates for this type of treatment. And we can achieve that by extensive workup that might include endoscopy and some other further tests. When the indication is correct to begin with, the patient seems to respond very well to this type of treatment. I would say that at least 80 to 90% of the patients, they will respond that they would have done the same procedure again. There is obviously some cohort of patients that they will experience improved but residual reflux symptoms, which they tend to be easier to be controlled with a combination of their operations and continuation of anti-reflux medication.